For this video, we will talk about the 3 common skin infections with their cause, symptoms, treatment, and prevention. What is a skin infection? Our skin is the largest organ of our body. Its function is to protect your body from infection. Sometimes the skin itself becomes infected. Skin infections are caused by a wide variety of germs, and symptoms can vary from mild to serious. Mild infections may be treatable with over-the-counter medications and home remedies, whereas other infections may require medical attention. We have here the first common skin infections. We have the bacterial skin infections. Bacterial skin infections, often begin as small, red bumps that slowly increase in size. Some bacterial infections are mild and easily treated with topical antibiotics, but other infections require an oral antibiotic. Different types of bacterial skin infections include cellulitis. Cellulitis is a common and sometimes painful bacterial skin infection. It may first appear as a red, swollen area that feels hot and tender to touch. The redness and swelling can spread quickly. It most often affects the skin of the lower legs, although the infection can occur anywhere on a person's body or face. We have here impetigo. It's a common and highly contagious skin infection that may affect infants and young children. It usually appears as reddish sores on the face, especially around the nose and mouth, and on the hands and feet. Over about a week, the sores burst and develop honey-colored crusts. And second one is the viral skin infections. Viral skin infections are caused by a virus. These infections range from mild to severe. Different types of viral infections include chickenpox, molluscum contagiosum, warts, and measles, and hand, foot, and mouth disease. For chickenpox, it is an infection caused by the Bacillus zoster virus. It causes an itchy rash with small fluid-filled blisters. Chickenpox is highly contagious to people who haven't had the disease or been vaccinated against the chicken pox. Today, a vaccine is available that protects children against chickenpox. We have here molluscum contagiosum is a relatively common viral infection of the skin that results in round, firm, painless bumps ranging in size from a pinhead to a pencil eraser. If the bumps are scratched or injured, the infection can spread to surrounding skin. Wart, a small growth with a rough texture that can appear anywhere on the body. It can look like a solid blister or a small cauliflower. Warts are caused by viruses in the human papillomavirus or HPV family. The appearance of a wart depends on its location on the body and the thickness of the skin. So we have here, viral infections include also the measles, the hand, foot, and mouth disease. And the third one, we have the parasitic skin infection. This type of skin infections are caused by a parasite. These infections can spread beyond the skin to the bloodstream and organs. A parasitic infection isn't life-threatening but can be uncomfortable but can be uncomfortable. Different types of parasitic skin infections include lice. Okay, lice are tiny wingless parasitic insects that feed on human blood. Okay, the one that when we're just a kid, I don't know if you have that, but I have that when I was a kid. But now I don't have. Okay, so that is lice. And we have here bed bugs. Okay, bed bugs are small, reddish brown parasitic insects that bite the exposed skin of sleeping humans and animals to feed on their blood. Although bed bugs aren't known to spread disease, they can cause other public health and economic issues. Okay. Scabies, scabies caused by an infestation of the skin by the human itch mite. Okay, we have here cutaneous larva migrans. Cutaneous larva migrans is a parasitic skin infection caused by hookworm larvae that usually infest cats, dogs, and other animals. Humans can be infected with the larvae by walking barefoot on sandy beaches or contacting moist, soft soil that has been contaminated with animal feces. We have here, okay, what are the symptoms of a skin infection? The symptoms of a skin infection, okay, so this one is overall symptoms. The symptoms of a skin infection also vary depending on the type. Common symptoms include redness of the skin and a rash. You may also experience other symptoms such as itching, pain, and tenderness. So if you feel any symptoms, see a doctor if you have pus-filled blisters or a skin infection that doesn't improve or gets progressively worse. Skin infections can spread beyond the skin and into the bloodstream. When this happens, it can become life-threatening. So signs of severe infection include pus, blisters, skin sloughing, breakdown, dark necrotic appearing skin, or skin that becomes discolored and painful. Okay, so those are the signs of a severe infection. So what are causes and risk factors for a skin infection? The cause of a skin infection depends on the type of infection. For example, we have here the bacterial skin infection. This occurs when bacteria enter the body through a break in the skin, such as a cut or a scratch or a wound. Okay, getting a cut or scratch or wound doesn't necessarily mean you'll develop a skin infection, but it does increase your risk if you have a weakened immune system or weak immune system. A decreased immune system can be the result of an illness or the side effect of medication. Okay, and we have here the viral skin infection. The most common viruses come from one of three groups of viruses: pox virus, human papillomavirus, and herpes virus. For parasitic skin infection, tiny insects or organisms burrowing underneath your skin and laying eggs can cause a parasitic skin infection. So how is a skin infection treated? Okay, so treatment depends on the cause of the infection and the severity. Some types of a viral skin infections may improve on their own within days or weeks. So here we have the bacterial infections. They are often treated with topical antibiotics applied directly to the skin or with oral antibiotics. If the strain of bacteria is resistant to treatment, treating the infection may require intravenous antibiotics administered in the hospital. So we have here also home care and alternative treatments. So home care for skin infection works to reduce the symptoms. So we have here home care may include the following. Number one, apply cold compresses to your skin several times a day to reduce itching and inflammation. Second, take over the counter. Okay, antihistamines to decrease itching. Take over-the-counter antihistamines to decrease itching. Use topical creams and ointment to reduce itching and discomfort. So, skin infection prevention. There are many steps that can be taken to prevent the spread of skin infections. The easiest and most effective way is to practice good personal hygiene habits like the easiest and most effective ways to practice good personal hygiene habits. Like showering and washing clothing and bedding regularly or washing hands. After skin infections have been identified, it is important to properly clean and disinfect surfaces and equipment to prevent the infection from spreading to others.